Myocardial diseases in dogs and cats. There are four types. The dilated cardiomyopathy, DCM, this is found in dogs. Hypertrophic cardiomyopathy, also known as HCM, which is found in cats. It's one of the most common cardiac diseases in cats. And arrhythmogenic right ventricular cardiomyopathy, ARVC. And the last one is restrictive unclassified cardiomyopathy, RCM. So DCM, dilated cardiomyopathy. In dogs, it's the second most common cardiac disease. In cats, it's very rare, but it's caused by taurine deficiency. It happens when there's a progressive loss of myocytes, numbers and functions, and they decrease the contractility of the heart, leading to eccentric hypertrophy. In basic terms, the heart dilates. The predisposition is it affects large breeds such as a Commodore and a Mastiff. It's more common in males than females, and it happens in middle-aged to old-age dogs. The causes are it's a final result of a myocardial insult. The clinical signs are weight loss, ascites, cyanosis, arrhythmia, a weak heartbeat, and increased cardiac dullness. There can also be dilation of the jugular vein. It can also cause left-sided congestive heart failure, which results in dyspnea and pulmonary edema. And it can also cause right-sided congestive heart failure, and the signs are a distended jugular vein and subcutaneous edema. For the diagnosis, electrocardiograph, ECG, is the only way to determine dilated cardiomyopathy. For the treatment, the aim is to reduce the clinical signs and give a good quality of life to the animal. So to improve cardiac pump function, you give pimobendan, and to reduce congestive signs, you give ACE inhibitors and diuretics like furosemide. For the prognosis, the survival time from appearance can be half a year to 1 year. The second disease is HCM, known as hypertrophic cardiomyopathy, but it's found in cats, so you say feline hypertrophic cardiomyopathy, or FCM. It involves left ventricular hypertrophy, which means the heart muscle gets bigger and the lumen gets smaller. The predisposition is it's the most common cardiac disease in cats, and it's found more often in males, and Maine Coons are more susceptible. It's found in Maine Coons and ragdolls. The muscle gets large, and with severe hypertrophy, necrosis can take place, and then fibrosis takes place. And then there can be backward flow into the left atrium, and then the left atrium gets bigger, and if it's severe enough, it can cause left-sided heart failure. The clinical signs is there's often a sudden onset after exercise or anesthesia. In an old cat, hypertrophic cardiomyopathy, it's possible that it could remain asymptomatic for a long time. This disease usually makes animals tired, gives them exercise intolerance, cyanosis, and they can make them collapse and give them dyspnea. The physical findings is it's often very serious and life-threatening. The dyspnea is caused by pulmonary edema due to the left-sided heart failure. On the diagnosis, on the radiograph, you can see an enlarged left atrium and an enlarged left ventricle. An ECG is the most useful for diagnosing hypertrophic cardiomyopathy, and you can also do a blood test or a urine test to see if there's any differential diagnoses at play. The treatment is that there is no treatment, but it's not necessary to treat if there's no clinical signs. It does not affect the development of the heart failure. The only drug that's anyway effective is furosemide, which can be really effective in treating hypertrophic cardiomyopathy. The prognosis, if it's in the asymptomatic stage, it's usually fine. If there's clinical signs, it can be better in 3 months. And if there's thromboembolism, it's very poor. The next disease is arrhythmogenic right ventricular cardiomyopathy, or ARVC. It's also known as boxer cardiomyopathy. It's an autosomal dominant trait which causes fatty infiltration of the right ventricle myocardium. It starts off as an arrhythmia, then there's no blood flow to the brain, and if it lasts longer than 6 to 8 seconds, there's a syncope, and then it has to spontaneously stop for death not to occur. The diagnosis is you need an early diagnosis with a Holter ECG, and the treatment without dilated cardiomyopathy is sotalol in combination with atenolol. The prognosis without dilated cardiomyopathy is good. They can last for several years. With dilated cardiomyopathy, it's very poor. They can only last a few months. The fourth disease is restrictive or unclassified cardiomyopathy. In cats is relatively rare. It normally appears in the left ventricle with an enlarged left atrium. The causes is a diastolic dysfunction or restrictive cardiomyopathy. The diagnosis use a Doppler ultrasound. It happens when collagen builds up in the left ventricle, which increases the diastolic pressure, which increases the size of the left atrium, which causes left-sided heart failure, and it can cause a thrombus formation. And the last thing that needs to be covered is a thrombus. It's often a sequel of hypertrophic cardiomyopathy. So first, in the left atrium, the blood flow slows down, and then the red blood cells aggregate, which when the flow decreases, because it's below a critical velocity, then the thrombus develops in the left atrium, they break loose and enter systemic circulation. Thrombuses can cause infarcts in different organs, and in the proximal part of the aorta, it'll cause sudden death. They often remain static in the left atrium. If they dislodge, they can go anywhere in the circulatory system. The clinical signs can be an sudden onset of weakness or hind limb paralysis. To diagnose, you do ultrasound or an angiography, and the treatment is hopeless. Normally, euthanasia or pain control is done.